Good morning, I'm Alexis Del Cid. Our team is working hard behind the scenes this summer to bring you all new episodes and patient stories for when we return for another season of All Things Brain Health in 1 month. Until then, please enjoy this Encore presentation.
Coming up today, 1 minute he's awake, the next minute he's opening his eyes 8 days later. How a collaborative approach by doctors and nurses at the University of Kansas Health System helped save Scott Miller's life. Good morning, I'm Jessica Lovell in for Alexis Del Cid this morning. Welcome to All Things Brain Health. One event turned Scott Miller's life upside down. He experienced a subdural hematoma, commonly known as a brain bleed. It's when blood builds up between the brain and its tough outer layer called the dura mater, creating a dangerous pressure. Doctors need to work quickly to reduce that pressure, and that's exactly what they did. Scott and his wife Lisa are joining us this morning, and we're so glad they're with us, along with Dr. Catherine Hussman. She is a vascular and neurologist and the medical director of the Neurointensive Care Unit. We're also joined by Dr. Andrew Gassaroon, an anesthesiologist and critical care specialist. We also have Dr. Sarah Hahn, the vice president of neurosciences, joining us virtually this morning. So great to have everyone here with us. Got everybody back together. Dr. Hahn, nice to see you as well.
Thank you.
Scott, let's just bring you in and start with your story. In late 2024, you were having headaches. You thought they were allergies or sinus problems. A lot of us have that pressure in our head going on. When did you think this was something more serious?
You know, it sounds strange, but I never thought of this as something more serious than that. The whole time, until the doctors told me in the ER that I had a subdural hematoma, it never occurred to me that this was anything serious. It was just a terrible headache.
Yeah, can you kind of describe the headache, maybe where it was? Because a lot of us suffer from headaches.
Yeah, it was actually on top. That's where the brain bleeds were, I guess. It was interesting because I would try and sleep with bags of frozen peas on my head just to try and numb the pain. So, yeah, it was just the worst headache I had ever had in my life.
And Lisa, at one point, Scott had such a bad headache that you convinced him to go to the emergency department. What did you find out that night that you all went in?
Like Scott said, we thought that he was just having severe sinus infections because back in 2015 he'd had 3 sinus surgeries, and so we just thought that's what this was. But it was bad. It's like waking up and in the middle of the night, and he just had the peas. I could hear the crunching, and so we took him out to Olathe Medical Center, and they did a CT scan, and that's where they came and told us that he had a subdural hematoma.
And at home, what were those conversations like? I mean, you know, as a partner and a spouse, I mean, you hear, you know, people complain about headaches and I'm not feeling great. I mean, when were you starting to go, this is maybe getting into a different territory?
I think the Saturday before we took him into the ER, we had gone to urgent care, and that's when that doctor said, you know, it's like you've been on all these steroid packs, you've been on antibiotics, this doesn't sound like maybe it is sinuses. And so anyway, he did say sometime in the future, if this continues, you might want to have a scan.
It was just escalating.
Yeah.
Dr. Hussman, you shared an image of Scott's brain. This is what happens when the fluid builds up.
Yes.
Dr. Hahn, Scott's headaches got worse. He went back to the hospital for a craniotomy. Can you tell us what happened during that time?
Absolutely. Well, first of all, you know, subdurals come in lots of sizes and shapes and can affect patients in lots of ways. And we typically try to address them as least invasively as we can, either, you know, embolizing the arteries that are leading to the area of the bleeding, or sometimes just drilling small holes through the skull and then using suction to pull the clots out. But in this case, Scott's symptoms were so severe and he was having so much pressure build up, if you will, on his brain that a craniotomy had to be performed. And just as you've seen in some of the other pictures, he had large incisions that were made sort of on the top and side of the head. And then the scalp and the skull are pulled back in those areas where the linings of the brain and the brain itself are exposed, where you can actually see the clot and completely remove it surgically in the operating room.
Dr. Husband, explain what's happening when that fluid is building up over time in the brain.
So just like you had described, there's a pressure effect. And so that pressure effect can have all kinds of manifestations. So initially Scott was having headaches, and it can start with just headaches, but then it can continue to build up, and then the brain isn't functioning like it should, and that can lead to lethargy, focal neurologic symptoms, and then even coma if it's severe enough.
So you have this craniotomy, and this is when things start to kind of get scary. Scott didn't wake up as expected, correct? Mm-hmm. Lisa, what were you told about Scott's condition after that procedure?
Well, after the surgery, the doctor came in and explained what they had done. That they had scraped all the old thick blood off of his brain, and everyone in the room was expecting him to wake up. I think that was typical. I don't know if that's typical, but they were expecting him to wake up, and so it was becoming concerning when he didn't wake up.
Right. And what were they telling you? I mean, and what were you feeling emotionally at this time?
Numb.
Yeah.
It's scary walking in and seeing your spouse laying there. I mean, I had no idea this was going to come down the pike and happen, and it was terrifying. But oh my gosh, the staff was amazing. They just were. We had Brad that day as our nurse, and it's just like just explaining everything that was going on, and that they were checking him every hour, and I knew he was being cared for, but I know that there was concern that he didn't wake up.
Dr. Husband, and Scott underwent a second procedure. It did not have the expected results. So then where do you go to find the next solution?
Well, that's when I was talking to the different team members in the ICU, talking with Dr. Gassaroon and saying, this isn't what I would expect in this case, any ideas, and we were collaborating on different thoughts about what this could be.
So let's bring Dr. G in. So what were those conversations like?
Yeah, I feel like we work together during the week. We talk about each other's patients, and we work collaboratively with the surgeons to try to find a solution. And in this case, when things weren't going as expected, it really just had us revisit what was the cause from the start.
I want to talk about physically what you were doing, because you laid Scott flat on his back to help save his life. You were pivoting and, like you said, trying to figure out what was next. How are patients typically positioned when they're intubated, and what made his situation unique at this time?
Yeah, so like Lisa said, Scott was not waking up as expected, and he wasn't coughing or clearing his own secretions well. So we needed to place a breathing tube to breathe for him to help him recover. Typically, patients are laid flat to be intubated if they go for a regular surgical procedure, but not typically in the neuro ICU. In Scott's case, we really just laid him flat to move him up in bed closer to me so that I was able to access his airway. I was surprised when we laid him flat that his exam improved. He opened his eyes, he moved both sides of his body, which was not something he was doing reliably before then. So he still needed to be intubated to help him get better, but that kind of put a spark in my mind and the team's mind that maybe from that there wasn't too high of intracranial pressure in Scott's case, but maybe there was too low of intracranial pressure in Scott's case, and he would benefit from laying flat and more fluids. And with further conversations with the family, it's what kind of changed our treatment path for Scott.
And it's certainly a spark in Lisa's mind, I would imagine. What were you thinking when they were telling you that there were some changes in your husband?
I don't think we knew that initially. It was just that day he wasn't responding well, and so any improvements were welcome.
Or a good sign of hope.
Yes.
Dr. Husband, here's a picture of Scott's brain, kind of a before and after on the left, and then after, that's the before on the left, and then after treatment on the right. So walk us through what we're seeing here.
So the picture before you had showed earlier with the red lines, because it's hard to see if you're not used to looking at CAT scans, but the one with the red line demarcated where the brain ended and where the blood began, the subdural hematoma. And so that showed that that was an extremely tight space because the skull was not able to accommodate the blood and the brain. And then the picture on the, I think that's your left screen, is after the surgery, and you can see the brain has been returned to its normal positioning, full, and everything looks great post-procedure.
Well, we have some questions coming in. If you have anything you would like us to ask or read aloud during our program, you can send it to us on YouTube or Facebook. Those links are right there on your screen. Lisa, I know that family and friends must have been a huge support during all of this time. How important were they?
They got us through it. Every day we had people coming into the room, we had people praying for us, bringing us food, keeping us company, talking with Scott. They were everything.
And there was a point that was so dire, I can't imagine this, that you requested a DNR, a do not resuscitate. How were you processing that?
That was Scott's initial surgery was on a Friday. His second craniotomy was on a Tuesday, and then we call it Black Thursday. Thursday was the day I think nothing. His brain wasn't responding well or at all. And our son is a doctor, our daughter is a nurse, and when they understood the gravity of what was going on, that's when, unfortunately, my children had to come to me and say, Mom, we need to have a serious conversation about where we go going forward. And so we made that decision.
Scott, what's it like to hear everyone talking about you during this time and seeing these images of you while you were intubated, and then you're here with us today? What's it like hearing these stories in the past tense?
It's weird.
Weird is a good word.
Woke up.
Yeah, I mean, it was, kind of a strange experience. It's like being, woken up in the middle of, really deep sleep. Is that's what I remember. I don't. All this stuff that was happening with my kids and all these people visiting, I have no memory of that whatsoever. So it's healing to help, get through this, to know that what was going on kind of with my family and friends and everybody. It was just a whole lot of support. It feels really good and helps me process through what happened.
I bet. Pretty surreal to hear those, know those conversations were happening with your wife and kids.
Yeah, especially the DNR thing. Hearing that it was that bad is kind of tough.
Well, let's talk about that extraordinary turning point that came at the end of January. Dr. Gassaroon, we have some video of Scott waking up. How did you help him during these initial wake-up moments? What was going on here?
Yeah, I think anytime you're waking up in the ICU, we try to be reassuring. We talk to him and reorient him. It's always useful. Scott had such a supportive family system, seeing his family members in the room with them, hearing familiar voices, not unfamiliar voices like us. But I think especially as he recovers, just trying to orient him as much as possible, and we were so excited with the result and improvement that he had so quickly.
That was my next question, Dr. G, is when this is happening, I know you're a professional, but when a patient is waking up after a moment like this, what is the excitement among you and the team?
Absolutely. I mean, we were so pleased. I feel like this is the case that I always come back on and hold close to me, and as an ICU doctor, we don't always have great outcomes all the time, and we can hold those bad outcomes with us, but it's also really useful to hold these good outcomes with us and remember them when times are tough, and this is one case I absolutely hold close to me, and just so pleased with this good outcome.
So well said. Scott, what do you remember what do you remember hearing and seeing for the first time?
I remember the questions from the nurse. I was intubated, so I couldn't speak, but I would just had to nod my head yes or no. She would ask me things about what year it was, where I was I in a hospital, was I in a hotel room, and just various things that helped orient me, because the last thing I remember was I was sitting in a chair at home, and I woke up in a hospital bed. So it did help to have the nurse ask those orienting questions, and that's what I remember.
Do you remember seeing Lisa for the first time?
Probably not.
I really don't. But I do remember seeing the nursing staff. Those are my
Those
first,
are good faces to see, though, when you're waking up, right, after 8 days. That's
Yeah.
maybe the first faces you'd want to see. Yeah. Lisa, then what do you remember when you first saw your husband for the first time waking up?
It was such relief, because it's like we had stared at his toes for 8 days, waiting for them to wiggle and move on their own, and to have him be awake and moving, and it was miraculous. It was.
I bet.
Yeah.
I bet. Dr. Hahn, I have to ask you, just hearing this outcome, I see the smile on your face. I just want to get your comments on this, and just when you hear these stories, what goes through your mind?
Well, it's heartwarming, and this is why we do what we do at the University of Kansas Health System. Dr. G said it well. We work together as a team, and we talk to each other, and when things don't quite make sense, we lean on each other to try to figure out why. So kudos to this team to have really figured it out, and I'm just thrilled to see how well you're doing, Scott. That's just awesome.
Did we ever figure out what caused this brain bleed?
We had a suspicion that it was from what we call a CSF leak. So CSF is the fluid around your brain, and because Scott had had sinus problems and sinus surgeries in the past, we wondered if there was some leaking from either his nose or some other part that's connected with the brain. We did subsequent tests, but never firmly confirmed that diagnosis. But with how well he did with the treatment, it seemed very plausible that that was the issue.
Dr. G, we were talking a little bit before the program that, it was a little bit of a mystery, because you couldn't just go to the medical textbooks and go, yep, that's what it was.
Yes, I mean, I think we would have loved to have a slam dunk, this is exactly what caused it, but regardless, with the amount of improvement, we were very happy. Overall, the diagnosis really came from talking among the teams, talking to the surgical team, the ICU team, as well as the history we were able to get from the family.
Well, we want to get to some questions and comments from our viewers this morning. Marie has a question for Scott. Sometimes when people wake up from comas, they remember what people were saying around them when they were there. Do you remember anything that was going on at the time?
I wish I could say yes. I do know that various members of my family and friends were talking to me. I know that my daughter played music for me, because they told me that, but I have no recollection of that. So I was out cold.
You were out cold. You were resting it up. Okay,
Yep.
So Jeremy wants to know, once you remove some of the clotting or fluids, does the brain shift around enough that the imaging you got before the surgery does not match how the brain is after the surgery?
I'm not sure I understand that question. Say that again.
Does the brain shift around enough that the imaging you got before the surgery doesn't match how the brain is after the surgery? Does that make sense? You're shaking your head. Do you get that?
With the clot evacuated, the brain has more room to expand. So I think that was the purpose of evacuating the clot, is so that there's less external pressure on the brain.
Yes.
Ann writes in, how do you coordinate between teams and specialists? Who makes the final decisions? Dr. Hahn, I'm going to bring you in on that. When we have such a big team of very specialized physicians, how does everybody come together and coordinate to make sure our patients get the best care?
Well, it's not always easy, but everybody has their role. So nursing staff, for example, are with the patient much more than the physicians taking care of the patient. And so their report of what they're seeing in between those visits as the physicians are coming in and out is critically important to help guide what those physicians order or next steps with the patient. And then each physician has a role. Dr. Gasseroon, Dr. Husband, they're in the ICU. They're looking at the whole picture of how the patient's doing from a medical standpoint as well as a neurologic standpoint. But surgeons, for example, are looking at potential complications of the surgery they've performed. And so everybody has their role and comes together to help guide what are the next steps for that patient.
Jamie wants to know, what are the warning signs of a brain bleed? What should we know?
Yeah, just like we had talked about before, headaches I think are a big one, and then changing your thinking pattern, and then when it becomes more extreme, sleepiness and lethargy.
That's when you should get checked out.
Yeah.
Tim is asking, can you have a brain bleed without hitting your head? I mean, Scott didn't, so apparently you can,
Right.
But what are some ways?
Absolutely, absolutely. Well, in Scott's case, which is kind of an unusual way to have a brain bleed, we suspected that the CSF was draining where it should not be draining, and then that caused a pulling or a pressure effect to encourage the brain bleeding. So that was how it occurred there. In other patients, even sometimes a small injury that they don't maybe even remember, or no injury, can cause brain bleeding, especially in vulnerable populations, people who are older or people who already have other comorbid conditions.
And other brain bleeds, such as from aneurysms, or deeper brain bleeds from high blood pressure, can also occur. So there are different types of brain bleeds that are different from Scott's, but those are other brain bleeds that can happen not from trauma.
Janet wants to know, why don't brain bleeds happen more often when someone has a concussion? Because we hear about concussions so often, but we don't always hear that there's a brain bleed involved.
I think the brain is well cushioned. We have this very hard skull for a reason, and it's able to move around. I think in general, concussion is more of the stunning injury of the brain, and then bleeding would be a much more extreme. But evolutionarily, or how we're made, as you're less likely to have a catastrophic bleed related to concussion.
Okay, so we've got hard heads.
Yeah.
Hard heads, okay. Dr. Hahn, Marie is asking, when part of the skull is removed for craniotomy, where do you put it while you're waiting for the swelling to go back down? Take us inside the OR.
Well, a couple of different options. Many times the skull and the scalp can just be put right back in place after blood is removed or whatever the operation is that's being done in a craniotomy. But sometimes if there's so much swelling in the brain, you need to leave the skull and the scalp sort of open. And sometimes we literally take the bone and put it in the freezer until the skull, until the brain swelling has gone down, and it's safe to put that hard skull back on there. So it varies, but sometimes we do have to leave it off for a period of time.
All right. Jenny wants to know if Lisa or Scott had any post-coma anxiety about Scott getting back to life and getting back out on the tennis court. Any nerves about just getting back out after it?
Not for me. The recovery was so quick. I spent maybe 4 or 5 days in rehab, and then I did some outpatient rehab, but I was back on the tennis court within 4 to 6 weeks after I got out of the hospital. So, but there's no lingering worries about it happening again or anything like that. I just am living life.
Living like Lisa, you didn't want to wrap him in bubble wrap or anything?
Well, sometimes if I come downstairs in the morning and he's like rubbing his head, I'm like,
That's what I'm saying.
I still have PTSD. But no, we had a follow-up with Dr. Davis, his neurosurgeon, after he was released from the hospital, and he just reassured us, because we had already had a trip booked to St. Martin, and so he's like, go, live your life, enjoy your life, don't let this hold you back. And so we had reassurances and excellent care.
Love to hear you're living life. That's the whole point. Sammy wants to know, how do you measure brain activity when someone is in a coma, intubated like this?
The one very important way we do that is with what we call neuro checks. So the nurses checking the patient every hour or every few hours, depending on how sick they are, and asking them all the questions. Where are you at? what year is it, and then lift your arms, you know, open your eyes. Those sorts of things tell you so much about how the brain is working.
And is being in a coma and intubated the same thing? I keep saying that. It's not, is it? As I'm saying that today, I don't think they're the same thing, are they?
So being intubated is the breathing tube in your throat and being on the breathing machine. And then a coma is just the function of how engaged the brain is in the world.
Okay.
So they often go together.
They're the same.
But they often go together. The being intubated is often required among patients in a coma, but they're not the same.
But Scott was officially in a coma.
Yes, because of his brain injury.
Because of the brain injury. Okay, just wanted to make sure I was using the proper terminology. Okay, question, Jean wants to know if Scott has any lingering side effects. I don't think you do you?
None. Again, I was, back playing tennis within 4 to 6 weeks after I got out of the hospital, and I did have a little bit of speech issue right afterwards, but that went away with some speech therapy, and I have no lingering side effects.
And what's the continuing care?
Nothing. Just again, living life.
Living life and
Yeah, it's amazing. It really is amazing to me.
We can't answer that question any better.
Yep, that was a really great outcome.
Dr. Hahn, with that, what do you want the big takeaway from Scott and Lisa's story to be today?
Well, I think one of the things that's super important, as someone who treats a lot of patients with headache is a super common symptom. We often assume it's sinus or a migraine or something like that, and often it is. But there are some warning signs. One is onset of headache over the age of 50, someone who's never had headaches before that suddenly over the age of 50 is experiencing them. Anybody that has fever or focal neurologic symptoms or signs, numbness, tingling, weakness in their arms or their legs, sudden change in vision, or headaches that gradually just get worse and worse and worse over days to weeks. And as Scott eloquently said, the worst headache of your life, all of those are signs, symptoms to immediately seek medical attention, get a scan, and make sure we're not dealing with something else.
Dr. Hahn, thank you so much. Scott, you expressed so much gratitude for your medical team and your care. What do you want the big takeaway from your story to be? What's your message?
First, I want to thank these doctors. They saved my life. I thank God for them every day. I also want to recognize and just tell you how wonderful the nursing staff was in the neuro ICU. I mean, they took care of me, but they also took care of my family, and that was amazing. And then I'd just say from a medical standpoint, I probably waited too long to be seen. I would, again, if I had a headache like that again, I would encourage anyone who has the worst headache of their life to seek medical attention and do it sooner rather than later.
Well, we're just glad you're here to share your story
I'm glad
and be
to
that
here.
warning for other people.
Yes.
So making that difference. Lisa, I know you've described Scott's healing as nothing short of a miracle, and your faith has played such a huge part in this story. What's your message and your final thoughts?
Well, I knew God was in control of this. It's like the night I called the ambulance, it's like I was praying and God's like, go check on Scott, turn on the light, look in his eyes. And when I did, that's when I knew something was wrong. So I knew God was in control of this all the time, and so I had that head knowledge. My faith, though, was my friends. I mean, everybody that came in that room, everybody that prayed for our medical team, everybody that prayed for Scott. It's just, I had head knowledge and heart knowledge that we weren't alone in this, but I just so grateful for these doctors. I mean, you guys, every time you walked in the room, I had confidence because you were just constantly, we've got more plans, we can do things, we're gonna take care of this, and oh, anyway, I can't say enough good things about the experience that we had.
Well, thank you so much for sharing and being here with us. Dr. G, I know this story means so much to you, and it's left a lasting impression already. What's your message? What's your big takeaway?
Yeah, absolutely. It's just so good for me to see this outcome and to see Scott and Lisa after this time. I think this is a great case about teamwork, about working together as a multidisciplinary team. Also, just a great case about family support in the ICU. Scott had such a great family unit and family support, and we were able to have those difficult conversations about about his code status, about do not resuscitate, about what he would want if he didn't recover, and that really helped guide our care. And I was really grateful for Scott's family for having those conversations with us and being able to come up with a united plan about our way to go forward. And again, so pleased with this outcome.
Dr. Hussman, what is your big takeaway from this story?
Well, I remember that conversation with Lisa when things were not looking good, and I said, okay, please trust me, give me a little bit more time. I think we can turn this around. And she did, and I'm so glad that she had the confidence in me, and just so grateful with the care that occurred. With all the teams working together. And that the case illustrates why I love working at KU, because you know, as you mentioned, the nurses, the collaborative team, the different doctors, we are all working together.
Yes.
And making great outcomes, and makes me so happy to see you today.
Thank you so much.